complex measure on Medicaid could keep the governor from expanding the health coverage program for the poor without legislative oversight. In swift moving approval from committee to the House floor in a matter of a few hours, House Bill 695 would keep the State Department of Medicaid Services from altering Medicaid without approval from the Kentucky General Assembly, a move that conflicts with Governor Andy Beshear's expansion of Medicaid to cover dental, vision, and hearing services. Among various new requirements for the state health cabinet, the bill would also authorize the cabinet to issue community engagement waivers to able-bodied Medicaid recipients with no dependents. It comes as House Bill 9, which establishes a Medicaid Oversight Committee, is also co-signed by the House.
What we are doing is we just passed a bill on the House floor that is the Medicaid Oversight and Advisory Board. We see that as a bill that will govern Medicaid moving forward. That's how we can wrap our hands around Medicaid and better manage it and make policy decisions as a body through that board. As I mentioned before, roughly 1 out of 3 Kentuckians is currently enrolled in Medicaid or CAIDSHIP. It's the second largest general fund unit within our state budget. And the growth we are seeing currently is at a rate that's just not sustainable. We're starting to see some pressure points. So all we are trying to do with House Bill 695 is just stabilize the program. Hold it where it is today. Let's get House Bill 9 Medicaid Oversight and Advisory Board set up so we can start running Medicaid issues through that bill. We can have the executive branch, legislative branch, outside parties come to the table and make better decisions moving forward.
Now, critics of those bills say they could lead to some Kentuckians losing care under Medicaid. House Minority Floor Leader Pam Stevenson said Republicans were moving too fast with the measures.
We are establishing an oversight board to deal with this mammoth of a organization, the Medicaid, and yet we're still in this bill going in, doing a little here, a little there, instead of letting the board handle it. The board will be up and ready to go, as you say, as soon as possible. And the big problem is we all say we don't understand it, so we don't know how many people will be kicked off because of this bill. This bill was heard in committee today at 11 a.m. and it's on the floor at 3 p.m. And so my concern is we're moving so fast on something that is complex by everybody's explanation. In fact, the gentleman today stated that nobody in the House of Representatives nor the Senate understood this bill, that we have experts that work it day in and day out. So why are we moving so fast to change? And there are changes in this bill. For example, if they can't implement it within 7 days, they have to let this body know. When have we done anything in 7 days, let alone read a bill, analyze the bill, see if we can implement it or not?
House Bill 695 went on to pass the House floor today along party lines, 80-19.